Hello, my friends. It's Jill Osborne from the Interstitial. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, October 26th of 2025, and it is time for another live IC support group meeting. I am currently streaming on 3 platforms simultaneously. We are streaming on Instagram when I'm looking here. Hello, Instagram. Nice to see you. We are streaming on YouTube and we are streaming on Facebook. Now, the purpose in me doing these meetings is to help patients struggling with bladder and or pelvic pain to find some answers, to help you see that you're not alone, that you have done nothing wrong. There is no shame. There is no blame in having pelvic pain. There's none. For many, if not most of us, this is all triggered by injury and or trauma. I was working with a patient yesterday. I mean, it's just so interesting working with patients. I mean, I've been doing this for 32 years now. And what really, how you guys breaks my heart are those patients who have told that they have an incurable disease when they don't. It's not a disease. It in fact, is injury or trauma to the pelvic floor, but it can be other things too. It could be a fibroid tumor pushing on your bladder. It could be endometriosis. It could be a tailbone injury. It could be pelvic congestion syndrome. Those are really small though. You know, for most of us, we're really looking at more major traumas like muscle and nerve trauma. So if you've got interstitial cystitis, if you've got pelvic pain, if you've got bladder pain, you are in the right place. Okay, so it's the week before Halloween, and if y'all know me, you know that I get comfort decorating and I get comfort moving things around. So I brought some of my favorite Halloween decorations back here, as well as a new painting I finished right there. And then we have another painting right here. I am very, very focused right now on doing things with my hands. I just love to craft and I love to write and I just want to do things. Oh, Kathy said, thank you for you like my glasses. Excellent. Glad to hear it. Okay. Anne says, I have shingles. Can you get urinary frequency from shingles? Yeah, you could if the shingles is low enough. So did y'all get our newsletter that I sent out this week? I sent out a newsletter that was a Q&A with the 3 pelvic pain doctors from Femetry. And whenever I send out a newsletter, I want to be educational. You never see me sending out, hey, do this, it'll cure your IC or anything like that. Because hello, I'm a researcher, I'm a scientist, I look for data, I look for hard facts. So whenever I'm sending something out, I want it to be educational. I don't ever want you to feel like you're getting a slick pitch from anybody, because that's not fair. Everybody's different. You are all an anatomical mystery to be solved. Our job is to try to identify your underlying causation and treat that underlying causation so that you don't have to take supplements or treatments for the rest of your life. A lot of people are really surprised. It's like, yeah, but that's how, that's what everybody says. It's incurable. And my answer is, well, what do our national guidelines for IC say? If a treatment's not working for you, stop what you're doing, take a step back and revisit the diagnosis. So anyway, this was a fascinating interview with the 3 of the top pelvic pain doctors here in Southern California. They said something in that interview that I have never seen anybody else say. And that is, we were talking about infection. We were talking about embedded infection. We were talking about why do patients feel better on antibiotics even though they don't find infection? And we were talking about all the different types of infections that you can get, fungal infections, viral infections, and of course, bacterial infection, because we do absolutely believe now that more IC patients have viral infections than we originally thought. I mean, when you think bladder infection, you're thinking bacteria, you're thinking E. coli or Enterococcus. You're not thinking Epstein-Barr mononucleosis. You're not thinking Candida. So anyway, it was a fascinating interview, and they said something in there I'd never heard any doctor say. And that is that they believe that children get a lot of viral bladder infections. Now, we know in the IC world, 5% of IC patients, they find active virus. We know that viral infections on the bladder wall are linked to what we call hemorrhagic cystitis. That means a bladder that's bleeding profusely. Our problem is when you go to the doctor with urinary symptoms, they're going to do a urine culture and they're going to look for bacteria. They're not going to look for virus. And yet we now have substantial data from the National Institutes of Health, from researchers around the world, that viral infections can happen in the bladder, and viral infections have been found specifically in patients with Hunner's lesions, the mononucleosis Epstein-Barr virus. And this is the first time a doctor said children often get viral infections. That just blew me away. And then I was reading something today it was a new study that crossed my desk this morning as I was going through my email, that was talking about the fall season and how so many kids are sick during the fall season when school starts, and how it just seems like the younger the child, the more likely it is that they're going to get sick. And we now have a research study that showed, crazy, when they were testing the presence of viral infections and colds and flus in school-age children, preschool, elementary, junior high, high school. The younger the child, the more frequent the infections. Of course, their immune system is building. But here's the part that just blew me away. That pretty much the young children, for half of the year had active viral infection. Can you believe it? That like every other day. I mean, think about it. Half of the year, this child in elementary school is carrying a virus that's giving them cold and flu seasons and could be contagious. And they made the very specific point that if you've got two young children in a row, or 3 young children in your home, the odds are you're going to have sickness in your home pretty much all the time. But as the child gets older, the everything calms down. So I think that it was like, if I remember correctly, and I can get it. In fact, I even have it here. Let me see, because I forwarded it to my sister. Let me look. Let me see if I can find this. I think that they were saying, let's see. No, I must have done it on Twitter. Like something like 82% for elementary school, 78% for junior high, and 72% for high school in terms of the rate of infection. So clearly, as children get older, the risk of infection drops. So anyway, talk about trick-or-treating. Man, having a virus in your home 6 months out of the year, that's bonkers. Okay, so normally when I do these meetings, I do a little 30-minute intro. Then I am happy to take your questions and answers. I'm happy to go as long as you want to go. Some meetings are 4 hours. Other meetings are 90 minutes. My schedule is open. I work 6 days a week. Actually, this week I'm working 7 days a week. I am here as long as you have questions. What I want to talk about to start this meeting off is, it's trick-or-treating. It's Halloween time. And as I love Halloween, as much as I love Halloween, I think we all have to understand that right now we're living with a lot of anxiety, that this is kind of a crazy world right now. There's a lot of stress in our daily lives. There's a lot of stress in the world out there. And there's a lot of stress when you get diagnosed with pelvic pain. For sure. There's a lot of stress if you've been diagnosed with interstitial cystitis. There's a lot of fear, especially, God forbid, you go onto an online support group and somebody says you'll have this for the rest of your life and you're going to always live with severe pain, which is not necessarily the truth for most patients. And that's my job to try to ease that fear. And I want to try to ease that fear for you. I do. But I want to talk very specifically about the fear of eating. Because come on, we're supposed to be able to enjoy trick-or-treating. We're supposed to be able to enjoy candy. We're supposed to be able to enjoy the holidays that are coming up. And that gets really hard when you've got a medical condition that's very, very sensitive to food. And God forbid you have 2 medical conditions that are sensitive to food, or 3 or 4. And there are a lot of patients out there who are just flat out afraid to eat. And I want to take that fear away from you today. So the key issues here, the great confusion here, aside from all the mixed information you get from other patients, here's the reality. Not everybody is sensitive to food. Got to understand that, number one. Patients with Hunner's lesions are going to be the most sensitive to food. Patients with pelvic floor dysfunction are going to be the least vulnerable to food. There are patients out there right now who can drink coffee, and there are patients right now who if they just inhale it, they will be up all night. Like they're so afraid of it, but that's legitimate. If you've got big open wounds in your bladder, 1 cup of coffee, 1 green tea is absolutely agonizing. So concept number 1 here is you're getting all sorts of mixed messages. It's like, why can she do it and I can't? That doesn't make any sense. Why can she do it and I can't? It's not fair. Well, the reason why she can do it is because her symptoms were probably driven by a pelvic floor injury, and your symptoms could be driven by estrogen atrophy. That would make you more food sensitive. And then we've got the other challenge here is that food reactions can be very, very inconsistent. So one day you can have a couple of sips of coffee. The next day you can't. One day you can have some chocolate. The next day you can't. One day you can go out to your favorite restaurant and you're good. A month later you try it and you're in bed for 2 days. That's always, always confusing. And the best way that I can explain this is it's really about kind of cumulative irritation. So let's say you follow the IC diet for 2 months, all of your symptoms calm down, you are good to go. You're like, oh my God, I'm so much better. And so it's like, you know what? I'm going to try to have some again. So you have maybe a half a cup of coffee or a half of soda. And you're okay that night. So you do it again. You're okay. You do it a 3rd time. Uh-oh. You're starting to feel a little frequency urgency again. You do it a 4th time because now you're back in. I love my coffee. I don't want anybody to take that coffee away from me. And I want my pumpkin spice latte. And by day 5, you drink that coffee and you're up that night. That's what I call cumulative irritation. So just, and as I say to patients, listen, if you had a wound on your hand, would you pour coffee on it? And the answer, I hope, is no. And what would happen if you poured coffee on a wound every day? Would it heal or would it get worse? It's going to get worse. And that stands for coffee, that stands for soda, that stands for green tea, etc. Okay. And so your job is to create an environment that will allow your bladder to heal and repair itself. So again, this is one of the things that's just so incredibly confusing is why can we do it one time and not the other time? It's like baffling. And then we have to throw in pressure. I mean, here's the reality is that our lives are centered around food and family events, whether it is a 4th of July barbecue, whether it is somebody's birthday at a restaurant, whether it is Christmas or Thanksgiving. Food is really, really important to favorite family traditions and family events. Yeah, Loretta, you're right. Loretta says conditions like IBS with ICA. I know I've been writing about that actually. So we have all faced scrutiny and criticism from others. Oh, come on, Jill. Come on. Can't you just have a bite of that? No, I'm not willing to risk pain. And for me, I can eat pretty much anything again, but now my heart is just like super, super sensitive. It's a COVID reaction. The genetics combined with the fact that I had COVID tachycardia on it. I was in the ER last Monday. Drove myself to the hospital at 2:30 in the morning because my heart went a little bonky again. I'm fine. I'm fine. I'm on the meds, but you couldn't pay me to drink anything with caffeine. You couldn't pay me to eat any chocolate right now because the feeling of your heart racing is awful. And then you don't want to disappoint grandma when she makes her lasagna on Christmas Eve, and you don't want to do this and you don't want to do that and hurt people's feelings. The harsh reality though is that we have to guard ourselves. We've got to guard our body a little bit. And if you're going somewhere and to somebody else's house who's cooking, this is when you make a phone call in advance and you just say, hey, I just need you to know I've got some dietary limitations. Can we work around that? Can we have something that I can eat? And then usually they'll say yes, but when you get there, sometimes it's a no. So this is when you bring some food for yourself or you eat ahead of time. But don't let anybody pressure you into doing something that is going to hurt you. And then we also have to deal with the fact that we all have PTSD over this. We've all had bad flares. And it's like I didn't drink anything lemony or limey for 28 years. No, 29 years because I had such horrific flares. And now I drink lemonade, very, very dilute lemonade every day. And that's because I'm not Hunner's lesions. I have a little bit of estrogen atrophy, but my dominant problem is my pelvic floor. My pelvic floor is much better. And so my bladder is more resilient and I can actually eat more foods, but I'm still careful. Okay. So inevitably, you are going to go through a period where you're just kind of afraid to eat. And you don't need to be afraid of food at all. It's about improving the quality of the food you're eating. And in some ways, it's forcing you to confront really, really bad habits. Like I was working with a patient this week who was in her 60s, severe estrogen atrophy. She and her husband pretty much ate out at fast food all the time, and she was flaring all the time. Spicy chicken, things like that. She didn't understand that she was in estrogen atrophy. She didn't understand that her bladder was more vulnerable. And her diet was, quite honestly, terrible. So the very first thing that you do is you have to start with the safe list. On the IC Network website, we have a diet list that you can download. It's free. It's like 15 pages. It's rated. It's got 3 columns: bladder friendly, try it, caution. You always start with the safe foods. Okay. It's that easy. And it's important that you just understand that there are common risk foods. And common risk foods for everybody. So listen, you got to lose the coffee for a while. You got to lose the green tea for a while. You got to lose the tomato sauce for a while. You got to lose the citrus for a while. You got to lose the artificial sugars. You got to lose the vitamin C multivitamins. Those might be irritating, not for the rest of your life, but just for a couple of months, just to give your bladder time to heal. Because in the end, that's our goal, is to try to get the tissue to heal a little bit more. Hey, Vicki. So instead, you're going to go to the safe list, the bladder friendly list of our diet list, and start with that. Okay. There's a ton of food there. The vegetables are your friend. There are so many vegetables that are IC friendly. There are fruits there that are some fruits that are quite ICU friendly. You should be able to do blueberries, pears, cantaloupes, Gala apples, Fuji apples, some of the melons. Of course, you're going to avoid citrus, and of course, you're going to avoid a lot of tomato, like tomato sauce. You can grill up a steak. It's fine. Just don't put hot rubs on it. Don't put spices on it. Don't do steak sauce. If you want to make biscuits, go for it. There's nothing in a biscuit that's going to irritate you unless you're gluten intolerant. But it's about staying out of the center portions of your supermarket that are filled with foods that are high in salt, high in sugars, high in acids, and getting back to real food, making real food. I, for example, hi, you guys. I do at least one rotisserie chicken a week. They're so easy. You can make it last, well, as a single person, I can make that last for 3 days, sometimes even 4 days. So I do a lot of stir fry veg. I do a lot of things with chicken, and inevitably at the end, I make a big pot of chicken stew or chicken soup. Because when you make it, you have total control over what's in it. You know exactly what's in it. Whereas if you go buy a can of soup, you really kind of risking more irritation from preservatives and all that sort of stuff like that, flavoring, spices, things like that. Here, hold on a sec. And then you want to, when you're ready, when you're starting to feel better, and when you're ready to try foods again, do one at a time and go into that try it list first. And the odds are you're going to be able to eat 90% of the foods in the try it category. Most people can. Just do them one at a time. Just be thoughtful. Just try one at a time. Wait 24 hours. You can try a small amount first. See how you do that night. If you don't have an issue with it, put it on your safe list. And you just kind of have to slowly work your way through kind of that try it list. But the foods that are in the caution category are obviously going to be the ones where we're going to say, please don't do those. There's a much higher chance that the caution foods are going to trigger a flare. And last but not least, there are some things that can help. You can do pre-leaf. Pre-leaf reduces the acid in food. If you can take 2 caplets of pre-leaf and reduce 95% of the acid in a cup of tomato sauce or a cup of coffee. I would ask you, though, if you had a wound on your hand, would you pour coffee with pre-leaf in it? And the answer, of course, I hope is no. Please don't do that. You got to wait until you feel better. Hi, you guys. So you guys, just so you know, for those who are coming in, we're streaming on 3 platforms. When I'm looking here, I'm looking at Instagram. When I'm looking there, I'm looking at YouTube. And when I'm looking here, I'm looking at Facebook. All right. And there we go. So don't be afraid to eat. You don't need to be afraid to eat. So Halloween, what can we do for Halloween? What can we do for Halloween candy? Number 1, white chocolate. Kit Kat makes a white chocolate candy that's called Bones. That should be fine. White chocolate is generally fine. It's the cheaper chocolates, milk chocolates, that tend to be a little bit more irritating. And I was reading yesterday, the darker the chocolate, the higher the level of caffeine in it, which is interesting. Cheaper chocolates tend to have a lot more preservatives and stuff in them. So we normally say go for the darker chocolates, but if you're caffeine sensitive, pass on that. But you can't lose if you do a white chocolate. White chocolate is the bomb. And, you know, at Christmas time, I got to say, M&M's does a mint white chocolate M&M that is to die for good. It's so good. There's nothing in it that would be irritating. And in fact, the mint would actually be soothing to your bowel and soothing to your bladder, potentially, because it's a smooth muscle relaxant. You could do licorice. You could do gummies. You could do nerds. There's just a lot of candy out there. I would stay away from sweethearts. Sweet tarts might be a little bit acidic. But but don't be afraid to have a little bit of a little bit of candy on Halloween. All right. I I'm I try not to have a lot of candy in my house. In fact, I don't have any candy in my house normally. And if I'm feeling the craving for candy, like with the, I do this at least once a year at Christmas. I go buy that bag of mint white chocolate, and then I'll sit in my car and I have like 10 of them, and then I'll throw it away because I don't want to eat anymore. Sugar makes cancer grow, and I'm a breast cancer patient, so I only do small amounts. All righty. So you guys, I need you to be the squeaky wheel. If you ask a question and I miss it, do not be offended. You do not need to be offended at all. Just write it again. So, hi, Gay. Hello, Johanna. Ann says, what is Femetry? Femetry is a company that is entering the supplement market. And their products, they were originally kind of designing their products for IC, but their products are really, I think, much better for patients with estrogen atrophy. And so Femetry has 3 different products: Femetry 1, Femetry 2, Femetry 3. Femetry 1 is all about restoring the biome after antibiotic use. So that's a win all the way around. I have no problem suggesting Femetry 1 as a probiotic for anybody who's using antibiotics. Femetry 2 is kind of a bladder soothing supplement, but it doesn't have chondroitin in it to coat the bladder. It's more of a glucosamine, a little bit of aloe, a little bit of this, a little bit of that in it, a little bit more soothing. What makes it different from every other supplement out there in the IC world is it has ashwagandha in it to try to calm the stress response. I don't see that as a bad thing right now, although I would want to do a lot more research on long-term use of ashwagandha. And Femetry 3 is an acid reducer like Preleaf. Okay, but it's really, I think, the best product in the line is Femetry 1, but they're all available. We've got patients who are buying them now, and it's worth a shot. You know, I mean, the blessing here is that you have a lot of options. You got to remember, 30 years ago, we had nothing. 30 years ago, patients were sent home with a medication that is now linked to blindness. And when Dr. Theoharides created Sister Protec and did his first research study with 250 patients that showed a chondroitin-based supplement was helpful in reducing the symptoms of IC, that completely changed our world. That was like 20 years ago, because patients saw that they could do something other than Elmeron, other than an antidepressant that might help some of their symptoms. And since then, we have a couple more supplements out there now that have a very sound, solid role in the IC world. Number one, because not a lot of patients have access to regular therapies, not that we have that many. Number two, they're a lot more affordable. And number three, they're not associated with the side effects. Our American Urology Association guidelines for IC in 2014 said they ranked treatments on 6 steps based upon the risk of adverse events. So step 1 was self-help, diet modification, and supplements. They want you to try supplements first. They specifically said it's because they don't carry the risk of what's in step 2. Step 2 is Elmeron and amitriptyline and a variety of other oral meds, antihistamines. Elmeron, of course, is now associated with blindness. Elmeron, I think, in my opinion, should be moved to step 5 if we were still using that system. Step 3 was bladder installations and pelvic floor physical therapy. Step 4 was neuromodulation. Step 5 was cyclosporin and Botox. And step 6 was surgery. Now, in 2022, those guidelines were revised, and we don't use that 6-step system anymore. Now it's about identifying your phenotype and treating based upon your phenotype. We don't want to waste time doing therapies that aren't necessarily going to have a chance to help. But that underlying concept of doing the least risky things before you do the more dangerous things is sound. It's solid. It's still in the guidelines. Another big thing in our guidelines that, and this is something I support 1,000%, is if you're not responding to therapy, if you're getting worse rather than better, stop what you're doing, take a step back and revisit the diagnosis. That is from our American Urology Association IC guidelines. Why? Because we don't want you doing therapies that aren't helping for a decade or longer. Again, for those patients who are doing Elmeron and it wasn't helping them, but they did it anyway, many of them now have very severe eye problems. So today we're being much more aggressive about evaluating how you're doing. If you're on a therapy and you're not getting better, maybe that's not the right therapy for you. And that's also very true with supplements. Supplement companies love it if you keep buying their supplements over and over and over again. Okay, but that's not, I completely disagree with that because I work with patients who are low income and struggling all the time. And the last thing we don't want to do is have you investing money in something that is not helping you. And again, it completely begins with your phenotype and trying to understand what your phenotype is. Judith says, I was diagnosed with severe spinal stenosis, L4, L5, L5S1 with cauda equina crowding. Yikes, girl. Can this be the cause of painful bladder syndrome or pelvic pain? Yes. Yes, because that's where the nerves for the bladder emerge into the spine and emerge out of the spine. Cauda equina is really kind of the most severe nerve compression you can have in your pelvis because if you lose the ability to control your urine or you cannot urinate, that can relate to nerve damage caused by cauda equina. And so generally cauda equina is considered an emergency and you should be down at the emergency room and they would normally be doing surgery to release this nerve compression so that you are not damaging those nerves. So it sounds like you're starting to show some signs of nerve damage from the cauda equina. So you're going to have to be on that really, really carefully. So is that going to cause bladder problems? Yes, it is, certainly. Now, does cauda equina cause pain on bladder fill? I'm not sure. I am not sure. I haven't worked with a lot of cauda equina patients. Generally, those are kind of orthopedic patients. But you got to be on top of that, girl. Judy says, I love to see you out there for us sightseers. Thank you for what you do. You are welcome. I wish I were traveling more. I wish I was. I wish I were going to conferences, but right now. But number one, we're not having conferences very, very often. And number two, I just have been dealing with my own stuff. Glenda says, in the middle of a flare now, don't know what caused it. Oh my God, cumulative irritation, spot on. Yes. Sherry says, I just had a colon resection, intestinal surgery on Wednesday. I'm still early with the recovery, but I'm hoping it will relieve some chronic pain in my pelvic area due to the obstruction causing pressure on my pudendal nerve. Prayers, please. Sherry, honey, big, big, big giant hug. Girl, you are over the worst. You've had the surgery. Yes, 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 my friend. I'm so glad the surgery is behind you, but now you're healing. And healing takes a lot of time. It takes a lot of time. I was working with one patient who had, she has not been able to sit for like 20 years. Like literally, she just hasn't been able to sit. It's too painful. Had to stand up and diagnosed with IC, diagnosed with a lot of other conditions. Done a lot of bladder therapies, other therapies, nothing ever fixed the fact that she couldn't sit down. And they finally did surgery. And you know what they found? She had 3 of those, the pudendal nerve and other nerves were completely flattened and compressed. And so they did surgery to relieve that, hoping that, and we're praying and hoping that with time, now that these nerves are no longer being compressed in her pelvis, the nerves will calm down, will start to heal, and she will be able to start sitting again and doing normal things again. Can you imagine Living a life where you can't sit down, where you can't sit in a car without crying, you can't sit at the kitchen table. I can remember back when I got started with IC, the United Kingdom IC group there was founded by a husband and wife, and the wife also couldn't sit. But back then we didn't know what that was. Now we know what that is. That's pudendal neuralgia. That's a muscle squeezing a nerve. So Loretta made the point about how difficult it is when you have multiple pain conditions that each have different diet limitations. So I'm actually working on this computer right here. I worked all day yesterday on it, on our new diet guide, and I've got a whole section on this and how do we mesh the IC and the IBS diet and the IC and the vulvodynia diet, which is normally low in oxalates. And then if you've got to reduce low salts like I do, or you've got to reduce saturated fats like I do, there is a way through this journey. And essentially it's about simple, fresh, healthy food, losing the fast food and the junk food and the heavily spiced food. It's about making real food again. Jennifer said, I was diagnosed 25 years ago, a couple years later, celiac disease. I think that has a lot to do with my bladder. You know, Jennifer, I just got an email from a patient who had been diagnosed with IC, really struggling severely with IC symptoms. She just found that she had celiac. And once she reduced gluten, all of her bladder symptoms went away. And it was Wendy Cohen who wrote a book. Let me see if I have it. Here, hold on. Yeah, here it is. So I talk about this in our new diet guide too. But now this is an old book. You can still get it. This is called The Better Bladder Book. It's by Wendy Cohen. You can get it on Amazon. She was the first to commit in writing, an extensive discussion about the role of celiac and gluten on the bladder. And I will say that, like, I got tested for celiac for sure. I was curious. Do I have celiac? I don't have celiac. But I will tell you very honestly, I feel much better going gluten-free. If I eat things that are high in gluten, I get very bloated and gassy, and I do not like being bloated and gassy. It sucks. It absolutely sucks. So playing with your gluten and trying different things is reasonable. Here, hold on. I'm just trying to move cameras around. Okay. So with luck, if you lose the gluten, maybe your symptoms will calm down tremendously. I really hope so. Vicky says, hey, girl, it's been a long time. Girl, it's been 30 years. I love it when people call me and they say, Jill, I talked to you 30 years ago. Do you remember me? And I'm like, oh, I'm really sorry, but I probably don't. But anyway. Hi, Nancy. Hi, Valina. All right. Now, you guys on YouTube, you're being very quiet. If you have questions on YouTube, don't hesitate to ask. I just have a lot going on this computer right here. So Loretta says, pre-leaf is great unless you have irritable bowel constipation. I don't know if we can say that for everybody, but clearly it's not for you. Rosalie said, had a cystoscope with fulguration, lesions, Botox, and hydrodistension. Felt great 2 weeks. Now you're back to square one. My symptoms make me multiple phenotypes as I have vaginal atrophy, vulvodynia. In 2015, I had a bad fall on my tailbone. My SE symptoms started. 2 years later, I'm at my wit's end. I have been told we have followed all treatment suggestions. I have ordered lactoferrin from the IC network. Just stopped all coffee. Girl, you've been drinking coffee this whole time? Had pelvic floor therapy. Okay, constantly in and out of bladder pressure, urgency, drawing, pelvic pain throughout the crotch after urination. Okay, so Rosalie, it's pointless to talk about therapies until we understand your anatomy. We have to understand your anatomy first. So, number one, you say that they fulgurated lesions. How many did you have? And have they checked to see if they've come back? That's question number one. And then, so I'm going to let you answer that question. With your lesions, how many did they have? And have they checked to see if they've come back? Because lesions need lesion-specific therapy. I think the lactoferrin is a great idea because the lactoferrin IC Hunner's lesion study showed that lesions healed and inflammation in the bladder healed in 28 out of 31 patients. But I want to know, do you have active lesions or not? We have two theories about what causes lesions. Theory number one is that it's an active viral infection. Theory number two is that it is something called posterior fornix syndrome. That is basically a damaged ligament that's damaging nerves, and a damaged nerve releases toxic substances which irritate the bladder wall and wound the bladder wall. So that's something else that we would potentially be talking about. So anyway, Rosalie, if you're still here, how many lesions did you have? It is raining here. Man, big storm. And I'm in Northern California. I don't know about you guys, but I'm in cave woman mode right now. I just am hiding in my cave right now. I don't feel, I feel like I'm just kind of, and a lot of it's just trauma. Hi there. A lot of it is trauma from having surgery and having cancer and grief and stuff like that. And I'm kind of in self-preservation mode right now. It's just like I just kind of want to be in my home and heal. I said to a friend yesterday, I said, I just want to go sit on a beach for a year and do nothing. Because life has been hard. Yikes. Hardest 2 years of my life, that's for sure. Rosalie said you had 2 scopes first. So you had 2 the first time, 5 the second time when you were in severe pain. You were told that you had a deep lesion. I didn't know this the last time, but you did not have these until 2023. Okay. So Rosalie, let me play devil's advocate for a moment. Let's ponder another scenario here. So you have been told that you have vaginal atrophy. And I don't know how old you are because I can't really see your picture. So think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste, right? Because urine is body waste. Urine contains ammonia and urea and all sorts of irritants. So how can the bladder hold ammonia for hours and hours at a time and not get damaged? It's a real evolutionary marvel because it turns out the way your bladder defends itself is with a really thick coating of mucus. So your bladder is wet and slimy on the inside. So your bladder is like your mouth. It's a hollow organ that's slippery. And this mucus is a barrier. It's a thick, robust barrier that's hydrophobic. Hi there. It pushes urine away from the skin so that ammonia cannot damage the skin cells. Okay, so your bladder, your urethra, your vulva, and your vagina rely on mucus for protection. But there's a problem. Mucus production is estrogen dependent. So what does that mean? That means that when you're young and you have a lot of estrogen, your bladder can make a lot of mucus. But girl, once you had a hysterectomy, you're 45-ish, getting older, or you're just through menopause like me, you don't have the estrogen anymore, which means you don't have a lot of mucus, which means your bladder's ability to defend itself is now greatly compromised. That literally there's the very little protective coating to leave urine, to push urine away from the more fragile cells of the bladder wall and the nerves on the bladder wall. That's called atrophy. We call it genitourinary syndrome of menopause. So you don't just have atrophy in your vagina and on your vulva, you have atrophy in your urethra and in your bladder. So this is a time when your bladder wall is exquisitely vulnerable and easy to hurt. So I was working like 3 weeks ago with a lady who's like 65, and she had just started drinking Mountain Dew again. And her bladder was screaming in pain. And she didn't make the connection. She didn't make the connection. It's like, wait, you just started drinking Mountain Dew? And she's like, yeah, I like it. And I was like, honey, your bladder cannot handle that at your age. That's why you're up all night. That daily acid erosion on the bladder wall massively irritated her bladder. Well, Rosalie, didn't you say you just stopped all coffee? So have you been drinking coffee continuously this whole time? With an atrophied bladder, that would cause profound bladder wall irritation. So that could help us explain why you're in such bad shape right now. And that could even help us maybe kind of understand why you had Hunner's lesions. Because you were pouring acid on vulnerable tissue every day. Slowly but steadily, acid erosion began to occur. You started having urinary symptoms. You didn't make the connection between the two. You kept drinking the acid on the wound just got bigger and bigger and bigger and bigger. So I'm super, super proud of you that you have stopped the coffee. That is very, very important here. You got no coffee, nothing like that for you for probably 6 months. I mean, I would give it at least 2 months with no coffee. You could do a rooibos herbal tea, a chamomile herbal tea, a peppermint herbal tea, hot water with honey, milk, things like that. Absolutely no coffee for you right now. No soda for you right now. No green tea for you right now. Be really careful with multivitamins, because your bladder wall is profoundly irritated. So why did you go from 2 to 5? Could have easily just been an acid erosion. And Rosalie's 76. Oh, here we go. Girl, we're in the same sisterhood. She was on an estrogen blocker due to breast cancer. And now you're on vaginal estrogen. Okay. I'm sorry, honey. Me too. My girls are gone. I'm flat as a pancake. Oh, it's so weird. And it still hurts a lot. It's so annoying. I have pain every day on these incisions. Okay. So it's great that you're on the vaginal estrogen, but you're never going to have a 20-year-old bladder again. You have a 76-year-old bladder that's getting a little bit of help from a little bit of vaginal estrogen, but diet's really, really important for you. Really, really important for you. So you could be a new woman in a couple of weeks just from losing the coffee. But I would just really want you to look at to make sure there's nothing else that's irritating your bladder wall on a daily basis, like doing a Centrum or a one-a-day vitamin or a vitamin C made with ascorbic acid. Be very careful of alkaline water or acid water. You want to just do pH neutral water. So don't be drinking alkaline water day or acid water all day. That's not going to help. Your next step, so understand that your normal mucus is slightly oily because it's hydrophobic. It pushes urine away from the skin. It pushes water away from the skin. Okay. And so here, where is it? Hold on a second. Here it is. If you're feeling atrophy on the outside, if your urine feels hot while you're peeing, we call it urine burn. Like you're peeing and it's hot and you're going, oh my God, why is my urine so hot? Your urine actually isn't hot. That's just vulva. That's just estrogen atrophy of the vulva. And this is when you would use vulva balm. Vulva balm. So vulva balm is a very, very, very light oil. It's an almost perfect match for your normal mucus. And you can put this on your vulva at the entrance to your vagina as a little bit of an extra protective coating. You can use it every single day. You can use it twice a day if you want. If you're struggling with a lot of urine burn, put it on before you pee, and it will prevent urine from irritating the skin. And then the second thing that you can do to, again, we're dealing with the fact that your bladder cannot defend itself particularly well because you're in the GSM, estrogen atrophy phenotype. You're going to want to look at one of the chondroitin-based supplements like Bladder Rest and Bladder Builder. We also have Cystoprotect and Cysto Mend. These are just the ones I happen to have on my desk right now. The reason why we want a chondroitin-based supplement is because chondroitin is a building block of the bladder wall. Chondroitin plays a critical role in the superficial integrity of the bladder wall. And chondroitin acts as a coating. So in Europe, liquid chondroitin is put directly into the bladder as a treatment. We call that Urosys or Ilaril. That's not available here in the United States. So our next kind of option variation of that is going to be a chondroitin-based supplement. Of course, we have digestion. And so the problem with any medication you're taking for the bladder is how much of it does it arrive at the bladder to be helpful. Like for Elmeron, the bioavailability is roughly 5 to 8%. Most of it's destroyed by digestion. With chondroitin, the bioavailability is about 25%, which is great. So we know plenty of it arrives in the bladder to provide a protective effect. So it might be interesting for you to try a chondroitin-based supplement. Now, some people say, well, what about aloe? Why can't I do aloe? Well, number one, the bladder's not made of plant material. Aloe is soothing. Aloe is soothing to a sunburn, for sure. Lisa, hold that question there for a moment. So if you had a bad sunburn, you could put some aloe on it and it would soothe it. We do know that aloe can be so soothing to the bladder wall, but it doesn't fix anything. You can't fix anything. We don't have a single published study showing aloe is effective for IC. It was popular 30 years ago, 25 years ago, because that's the only thing we had. But once the chondroitin supplements came out, the role for aloe became very, very small. And today, now that we're phenotyping in my opinion, the only place for aloe is for using it during it's short term for bladder wall flares. So I personally believe that the chondroitin-based supplements are going to give you a lot more long-term benefit than an aloe product, which is why we don't sell aloe anymore. I mean, I sold aloe for many, many years in the IC network shop, but now the only aloe we have is Aloe Path. And that's a combination of aloe and PEA, which I think is great because PEA calms nerves down. Anyway, okay, enough on that. So I'm really glad you did the vulva bomb, but if we're gonna try to address that estrogen atrophy, look at a chondroitin-based supplement. Okay. Okay, you guys on Instagram, feel free to ask questions. It's okay. Okay, so hold on, I got the wrong mouse here. I used to do these meetings on 3 computers. Now I'm doing them all on 1 computer. So there's a lot of windows. Lisa said, what is alkaline water or acid water? Lisa on YouTube. Okay. So, how do I say this as a chemist? Because I have 2 degrees in chemistry here. So acidity versus alkalinity. Acidity would be like vinegar. It would be like lemon juice. It would be like hydrochloric acid. There are mild acids, like that little bit of lemon that you might put in something for flavoring, or you've got acids that are so dangerous, 1 drop on your skin will burn your skin. When I got my first chemistry degree, man, they just scared the living daylights out of us over safety with these very, very, very strong chemicals. You learn to respect it immensely. We always wore safety glasses. We always had gloves, and we always had jackets, because 1 drop in the wrong direction in your eye could leave you perfectly blind. So there are degrees to acidity, mild to severe. There are also degrees of alkalinity. So pH 7 is neutral. That's normally water. The human body is designed to survive on water. So we like neutral. If things are a little bit more on the acidic side, they're going to be more irritating. But things that are alkaline are also going to be irritating. And the best example that I can give you is, have you ever spilled bleach on your hand or on your finger? If you've ever spilled bleach on your finger, one of the things you notice really quickly is it gets slippery. And the reason why it gets slippery is because it's dissolving your skin. It's bad. This is why you always wash bleach off. And so just as we have to be very, very safe with strong acids, we have to be very, very safe with bleach and things that are extremely alkaline. Again, our goal is to be pH neutral. Now, I can remember I went to a food show, because we used to go to a lot of food shows looking for low acid food for IC patients. And I did my first sample of alkaline water. I remember it was at a San Francisco fancy food show. I did 1 little shot, like 1 little thing of alkaline water, and it destroyed all the mucus in my mouth. All of it. Like, I had the worst mouth pain afterwards. You know, that feeling of really, really, really dry mouth? Oh, it was horrific. And in my brain, I went, oh my God, if that's going to strip the mucus out of my mouth, what is that going to do to the mucus in my bladder? So there are companies out there who have gotten rich by telling you that you're too acid. The reason you have IC or other diseases is because you're too acidic. So you need to drink my alkaline water. That's bullshit. That's just bullshit. Excuse me for swearing. Human body controls acidity levels to the thousandths or 10,000ths degree in your bloodstream. If your acid levels were off even like 0.1%, you would probably be dead. The human body simply does not become overly acidic or overly alkaline unless there is a major physical problem coming up. Acidity can happen in your urine based upon what you're drinking, eating, or drinking, but your whole body in general, anybody who's saying you're sick because your body's acidic, they're just full of it. Sandra said, does pre-leaf work if taken before Centrum Silver? Sandra, I cannot begin to tell you the number of patients who have called my office who have flared after Centrums, and I'm one of them. The last time I tried a Centrum, I had a horrific flare. So I think that you have to remember that these big mass market companies, they're sourcing the cheapest ingredients they can. And the cheapest form of vitamin C, ascorbic acid, comes from discarded fruit, citrus fruit. And so it would be much better for you to do, this, which is our low acid vitamin, Bladder Smart. It's a low acid vitamin. I was the first person to come up with the idea of a low acid vitamin like 15 years ago. I was working with the CEO of FAR Laboratories back then, and he said, Jill, if you could make anything for an IC patient, what would you make? And I said, oh, I know exactly what I'd make. I'd make a low acid vitamin, because I had phone calls every day from patients saying, is there an IC friendly vitamin that we can take? And my answer back then was no. And that really intrigued him. He was like, oh, that's interesting. He called me back 6 weeks later and said, we've made you your first low acid vitamin. And that was a vitamin called Multirite. The problem, and so we sold Multirite for many years. I took it too. The problem is that it was a horse pill and it was hard to swallow. And then that company had issues. They ended up being bought out by another company. And so I went to Natural Approach Nutrition, the company that makes Bladder Builder. And I said, can you please make us a low acid vitamin? And they did. And that's Bladder Smart. Bladder Smart. And this is the low acid vitamin that we suggest to everybody. Now, I know a couple of other companies have copied us now, but I'm very proud that this was my idea. I wish I owned it, to be quite honest. I have more products in the works, but I've learned not to give my ideas away. I just have to come up with the money to make them on my own. So I have another one product next year that I'm going to trademark and make it on my own, that I think will be very helpful. Okay, Laura says my thyroid was out of whack this summer from losing 30 pounds in 3 months. Could this have caused levator ani syndrome? I'm doing physical therapy. It's helping me. No, I wouldn't expect that thyroid levels are going to cause a problem with your levator ani muscles. I think it's more likely that you lost so much weight and potentially fat on your tush that when you're sitting down, you're basically sitting on muscles and nerves, that you don't have the fat protection. And that pressure of that might be why you're struggling more with levator ani syndrome. The levator ani muscles are your pelvic floor muscles that go kind of from front to back, low to high, and side to side. So they're at the base of your pelvis. And normally when you sit, you've got a nice layer of fat on your butt that protects them. But if you lose all that fat, you're now sitting on muscle and bone. And that actually is quite uncomfortable. I did that. I had gastroparesis like 10-15 years ago, and I lost a ton of weight, and a ton of weight. I didn't have an ounce of fat on my butt, and I had so much trouble sitting, and my muscles were messed up. Gastroparesis is a nerve problem with your stomach. It's way better now, but You know, it matters what you're sitting on. And if you don't have a lot of protection, you're going to irritate those muscles and nerves. Michael says, hello, Michael. Nice to see you. I'm 70 here. I have Hunners, had 3 resections over the past 4 years, temporary relief only. Dude, wait a second. Are you saying that they have surgically removed your lesions 3 times? So when they have removed your lesion, are you saying that new lesions are appearing on other parts of your bladder? Wow. Okay. Michael, have you had Epstein-Barr or mononucleosis? You have any exposure to mono even when you were younger? They didn't photograph your bladder? Well, that's a must. At this point, every single time they go into your bladder, you better damn well have a picture of your bladder. Because what you're describing is more on the severe scale. And I think you need to be able to visualize it to really see what's happening with your bladder. He says, not that I'm aware of. Okay, so Hunner, there are 3 theories as to what causes a Hunner's lesion. And let me grab some pictures. Hold on a sec. Are they down here? Let's see. Yeah, here they are. Okay. So let's just ponder this here for a moment. Okay. That's a good picture right there. Okay, so Hunner's lesions are visible bloody wounds on the bladder wall. So let's look at this for a moment. So there you go. Y'all see that right there? Now it's very obvious. You see that right there on Instagram? Clearly, that is a wound. And clearly, if urine goes into that wound, it is going to hurt like hell. If we look at these Hunner's lesions show that sometimes they have a little red spot in the center. We call that a coagulum. Hunner's lesions occur in roughly 5% of IC patients. Know that most of us have normal bladders. And this is where we understand that IC is not the same in all of us. There's tremendous diversity. IC is the equivalent of a grab bag diagnosis. So for some people, IC begins in childhood. For others, it begins after menopause. For some people, IC begins after they fall and break their tailbone, while for others, it begins while they go through chemotherapy. So we're not all the same. And we all do not have a disease process happening. There's a lot of injury too. But when you look in the bladder, there is a significant group of patients, 5, maybe 7% of patients have these visible red spots in their bladder. And when you biopsy these bladders, and you biopsy these lesions, there is a massive inflammatory process happening. The inflammation inside one of these lesions is enormous. I mean, there is clearly something happening in the bladder of these patients. So about 10 years ago, researchers in Europe were studying the urine of patients with lesions, and they made a fairly remarkable finding. And that is that they found virus in the urine of patients with lesions that was not found in the patients without lesions. And the virus they found, there are a couple of viruses they found. One is called the polyoma virus, polyoma BK, polyoma JC, and they found Epstein-Barr, the mononucleosis virus. Now, there is precedent. We already had research that showed that viral infections could infect the bladder and cause hemorrhagic cystitis, that bladder walls bleed profusely when there is an active viral infection. So we already had that. We already had that data going back to the 80s and the 70s. So we knew viral infections could happen. This is the first time we'd actually seen them in IC patients. So the Europeans, I talked about it in our meeting. You could go back, because I've been doing these live meetings for years now. You could go back and look at me talking about that, because we were all like, okay, you found it. You found it. You found something. In Hunner's lesion patients, it's very different. And so the Europeans did more studies. We had a couple of more studies come out that continued to identify viral infections only in patients with lesions. And so we're all like going, okay, U.S. experts, where are my U.S. researchers here? The U.S. researchers, our MAP Research Network, were suspiciously silent. What we didn't know is they were doing their own study for 5 years. So the MAP Research Network had hundreds of urine samples of IC patients over time. That was our federally funded IC research team. So they went back and they looked at that research, and you know what? They found it. They found viral infection. And so now we have, this was just maybe 4 or 5 years ago. So now we have some researchers who are now actively looking for viral infections. And if they find a virus, they treat these patients with antiviral meds, the same antiviral meds you would use for a herpes outbreak. That's what they're doing. So it would be very interesting to potentially have a viral screen. You can get all this research on the IC Network website. I have the studies. You could call your doctor and say, hey, I've got Hunner's lesions. They keep coming back. And I've just learned that viral connections have been connected to this by our own National Institutes of Health. Can we just do a viral screen and just see if I have active virus? Because if you do, they can then potentially treat it with an antiviral, just out of curiosity to see if that might help. Now, last year we had a study. Where is it? I got to find it here. Hold on. Here, give me a quick sec. Oh, here it is. Here it is. So last year, something remarkable happened. We had a study with Hunner's lesions, IC, and something called lactoferrin. So lactoferrin is a critical protein found in the human body. Our body makes lactoferrin. We have lactoferrin right now in our tears. It's just throughout our body. It is considered a front line of defense for the immune system. It is one of the most important ingredients in mother's milk and colostrum, because the purpose of colostrum is to help build that baby's immune system. So the mother gives lactoferrin to the baby. So lactoferrin plays a critical role in our health overall. Unfortunately, as we get older, apparently our ability to make lactoferrin diminishes. So we have a lot of research now that has been studying lactoferrin in adults for a wide variety of medical conditions. So last year, a lactoferrin IC study was done in Italy, at a university in Italy. And the results were phenomenal. That they had 31 patients in the study. They took lactoferrin like this from Australia. They took it for 4 months. What made this study very powerful is that they looked at the bladder before and after treatment with cystoscopy, and they measured systemic inflammation before and after treatment. And at the end of that period of time, 28 out of 31 patients had a total healing of their bladder. Their red inflamed bladders became pink and healthy. Their Hunner's lesions virtually disappeared. And most importantly, systemic inflammation throughout their body also dropped as measured through blood testing. So why would lactoferrin help a Hunner's lesion? Because it's a natural antiviral. So Michael, this is kind of something you could try. It's just one of those, give it a shot, see what happens. I have on the front page of the IC Network, I have a blog that gives you all of the research. You can look at the research yourself, see if you think it's comfortable. There were no side effects in the IC study. This is not a man-made lactoferrin. This is not made in a laboratory. This is real lactoferrin that comes from cows. There are some companies out there who are selling human lactoferrin, and you could buy lactoferrin, human lactoferrin, but it costs you a massive amount of money. Okay, Michael says, I watched your earlier video about lactoferrin. Used it for about 5 months. It seemed to help at first, but after a few months, they came back. Well, damn. Okay. How do you know they came back? Is it that your symptoms came back, or did they look at your bladder and did the lesions come back? You know, Hunner's lesion patients, they looked. Okay. So how did you get a viral test? Did they look for virus? Because there are two other theories here. But did they actually do any testing to see if you had an active viral infection? Well, worth doing. I mean, it's just a blood test. I think it's worth doing. Okay, so let's go to our second theory about Hunner's lesions. Nerves. When a nerve is profoundly irritated, it releases something called substance P. Substance P is damaging to tissue. So think about a herpes outbreak. When you've got an attack of herpes, everything turns red and gets very, very irritated. Part of that is nerves that are very, very inflamed. So substance P released into tissue is going to cause redness, and over time, it's going to cause irritation and inflammation. So we had a study a couple of years ago. It was a case study of a woman with Hunner's lesions who also had a prolapse. So she couldn't pee. And when they opened her up to repair the prolapse, they found that her uterus was free swinging like this because a critical ligament had broken. It's called the uterosacral ligament that was not holding her uterus into place. It had broken. So when they repaired that and got everything back in the right position, her Hunner's lesions completely disappeared. She is considered a complete and total cure. So the question then becomes, hello, I'm a man. Well, but you still have ligaments and nerves. So it turns out this ligament holds nerves in place. And so when this ligament gets stretched out, the nerves get stretched out. When the nerves get stretched out, they become very, very inflamed. The name of this is called posterior fornix syndrome, and they have found it in men. They have found this neuroinflammation in men also. And we can look it up here, but I need to take a bathroom break. All right, everybody, let's take a bathroom break. Be right back. All righty. All right. So, Michael, did you suffer any nerve injuries? Did you suffer any pelvic injuries that could have created a foundation for all of this? No. Okay. Have you had a pelvic floor assessment? Because if your muscles are tight, they're going to consistently. Okay. So that's a missing piece of this puzzle here. It's a strong missing piece of this puzzle here, is that the vast majority of men diagnosed with IC, and when I mean vast majority, I mean over 90% of the men diagnosed with IC, we can trace it back to a muscle problem, a muscle nerve problem. And our national guidelines are very, very clear now. Like the single most important diagnostic test now done in the doctor's office for new patients with IC is a muscle assessment. Because if your muscles are tight, you are to be immediately referred to pelvic floor physical therapy because physical therapy works. And we have to focus on your anatomy here. We do not have the total picture of your anatomy. Yes, we know you have Hunner's lesions, but what we don't know is what's the health of your muscles. And this is where Western medicine fails the pelvic pain patient, and especially for guys, because if you walk into the doctor's office with frequency urgency, they're going to just tell you you've got prostate problems and probably put you on antibiotics, in some cases for years, without looking at the bladder or beyond the bladder. Sometimes the bladder is a victim of something else happening in the pelvis. And we now have come to see and come to recognize that it's actually muscles and nerves that are injuring the bladder and causing some of these things. So I would, out of an abundance of caution, want you to have a pelvic floor assessment. Whether you had the tight muscles before or after the Hunner's lesion started, we know we've got to get those treated to calm the nerves down. And then I think the other question is, are we dealing with any immune system issues? Did your doctor ever suggest cyclosporin to you? I mean, cyclosporin, which is an immune suppressant, is considered a bit of a miracle drug for some patients with IC who have not responded to other therapy. And so if there's any sign of any immune system dysfunction, cyclosporin might be an answer for you. Also, would you be willing to go to a physical therapist and at least ask to see if muscles could be playing a role in your symptoms? I know it feels like your bladder. It felt like my bladder for me. I believe that I had a bladder disease for 30 years, longer than that. When for me, it all began after I broke my tailbone. It's always been muscle and nerve driven for me. And when they've looked at my bladder, I've had a fairly healthy bladder. You would be willing to go. So there is a website, pelvicrehab.com. That's short for rehabilitation, pelvicrehab.com. So you can go to pelvicrehab.com, put your zip code in, and it will show you the physical therapists trained. A lot of them are now working with men too. Some just work with women. Others work with men and women. You want to look for one that's fully certified. They're going to have a yellow marker. I would encourage you to go at least once. And let's just try to understand your anatomy a little bit more. Because if you rode motorcycles, if you played football, if you rode bicycles, if you were in the military and you jumped out of planes, if you took, if you go to the gym, if you're a weightlifter, if you're a heavy weightlifter. I was working with a 30-year weightlifter last week who's got horrific muscles. And he just didn't understand that the muscles, that when you stress these muscles, they're going to go into tension. They're going to start squeezing blood vessels. They're going to start squeezing nerves and cause tremendous problems. So that would be my next step for you. And then I think I would be looking a little bit at cyclosporin and maybe have a conversation with your doctor about cyclosporin. The biggest problem with cyclosporin is that it can cause high blood pressure. And for some patients, that's just not something that they can risk. How do I spell that? Let me type it for you. So here, let me give you this. Pelvicrehab.com is a physical therapy website, and cyclosporin would be worth some research and discussion. I mean, I have worked with many patients who have done cyclosporin, and it's the one thing that really helped. And when bladder therapies didn't work, when other things didn't work, the cyclosporin was kind of the last shoe out of the treatment bag before surgery. And there are plenty of patients out there who are doing it with success. You just have to understand that it's not an easy medication. It takes a special doctor to prescribe it for you. It's got to be monitored fairly carefully. And it's also prone to causing fairly significant side effects. So you got to have your eyes wide open with cyclosporin. So I have one friend that I'm an IC patient who I met through the IC network, who's now become a very good friend. I've known her for 25 years. She did lots of bladder therapy. She did everything. Nothing worked for her. She was a teacher. She had to do bladder installations before school. She had to do bladder installations after school. Unfortunately, needed a lot of pain meds. The typical bladder therapy is not helpful. And they finally put her on cyclosporin, and that she didn't need pain meds after that. Or she was able to cut down dramatically with cyclosporin. But eventually, a year or two later, she developed very, very high blood pressure. So now they monitor her blood pressure very carefully. So that is an option. And You've already had 4 resections, and so that tells me that your bladder probably is fairly small now. So I kind of want to know what the size of your bladder is, and where you are on a kind of bladder functionality. I mean, because you might be a candidate for, a cystectomy, bladder removal. The patients who have unresponsive lesions actually respond the best to big surgery. But I've worked with plenty of patients who are so happy they had the surgery because they don't have pain anymore. But that's a whole nother story. And I know that sounds really scary. Our goal here is to make sure that you just know what your treatment options are and the pros and cons of your treatment options. And I want you to carry hope here, because all is not lost. You've got at least 3 strong contenders that you can do. So we want to check for the virus for sure, check for the muscles for sure, consider cyclosporin. That might help the immune system. And, in a year or so, if you're not getting success, maybe bladder removal might be an option. And I, again, to be not tied to a bathroom and not in that pain is a great relief for many. We have a bladder removal forum over on the IC network and a support forum you could check out, but it's way too soon to go there. But just know, I just want you to know you got a lot of options right now, a lot of options. Christina on Instagram said, after 3 years of fighting, I've been approved for disability. Yeah, yay, good. They finally agreed. You've been disabled since 2017. Congratulations, hon. Congratulations. I'm so happy for you. So you're welcome, Michael. Michael said, thank you for your help. So I have a funny Social Security story for you. I turned 65. I can't believe it because I feel 25. And once you turn 65, you are forced to sign up for Medicare unless you work for a company with over 20 employees and you have health insurance. And the IC network does not have 20 employees. But I was thinking I didn't want to do it until I was like 70. I don't want to retire until I'm 70. I think I've got 5 more years than me, maybe more. But then I didn't realize that if you don't sign up, you get penalized 10%. And that's like, no. So I went, and you have 3 months before and after your 65th birthday to sign up. So I waited until 2.5 months, gave myself a couple weeks as I didn't want to do it. I go in to do it and I create my account, and my data does not match my Social Security record. And I got this giant error. I got this big error and I'm like, what? How is this possible? And so, and we have a lockdown or a shutdown with the government. So I'm like, oh man, I'm screwed. Is the Social Security office even open? Well, anyway, I made a couple phone calls. Do not call the national office. Call your local office. I drove down to my local office, got their phone number because it was a 3-hour wait. And I called, and the lady on the phone checked my record, and she's like, okay, where were you born? And I said the city, and she goes, oh, well, they cut the last 3 letters off the city. So they don't have you in that city. They like abbreviated your city name. And then she goes, and what's your mom's maiden name? And I gave it, and she goes, yeah, they cut that off too. Like the last 3 letters of my mother's maiden name and the last 4 letters of the city where I was born were not in my Social Security guideline. And then they had my birth date off by 1 month. So my appointment is on Thursday. I have till the end of the month to file. I'm by a day. I have to prove who I am with my birth certificate and other stuff like that. So anyway, anybody out there who's getting to be of age, don't do what I did and wait too long. understand that you have to sign up for Medicare. Start 3 months before your birthday and just be done with it. Don't wait like I did. I hate feeling forced to do stuff. I am drinking my herbal coffee dandy blend. It's good. Hi, Karen. So we are doing a live support group meeting right now on 3 platforms. We are on Facebook, YouTube, and Instagram. I am here as long as you have questions. Once you are done, then I am done and I will go paint. Because that's what I'm doing right now is I am painting. I've got a beautiful painting I'm working on right now of a cat sleeping in a library. I love it. So give me your questions. I'm happy to take your questions. Now, just so you know, here. So the IC 101 Flare Guide is now out. 80 pages all on managing bladder wall flares, pelvic floor flares, neuralgia flares, stress flares, menstrual flares, urethral flares, vulvodynia flares, rectal flares, sex flares, and allergy flares. So very, very happy with this. It's starting to fly off the shelf. I'm really glad because this is 30 years worth of insight to help you manage your flares. I am working on the diet guide right now. That one right now is 140 pages. And I'm going to say it's 70% done, maybe 75% done. Then after that, we're going to be doing our new medical journal. And then after that, we're going to be doing our pain management guide. So I hope to have all those done by the end of the year so that I can then go into other things. And if you're not a subscriber to the IC Network, our subscribers get our magazine, the IC Optimist, which is where we do our best work. Every time I send out a newsletter, you got to understand, if you're on the internet, you're going to get people who love you and people who don't like you, right? And every time I send out a newsletter, and it goes to about 30, 40,000 people, I'm going to get people who like what I sent out, and I'm going to get people who don't like what I sent out. And if you don't like it, they unsubscribe, and that's fine. It's fine. Every time I send an email out, we get like 30 unsubscribers. It's okay. I'm not worried about that. So I had somebody emailing me who said, thank you so much. It was a good newsletter. And then I immediately had somebody who emailed me who chewed me out and said, not enough science. It's like, I can't win. I just can't win. If I do too much science, it's hard to read. If I do too little science, I'm criticized. Diane said, I'm going for my second steroid injection into my bladder because of my lesions. The first time I had this done was 7 months ago. My doctor said I can do this every 6 months, but I worry about doing it so often. Is this truly a good long-term treatment for Hunner's lesions? Well, honey, the advantage of doing steroid injections is it doesn't leave any scar tissue. It's not known for being particularly harmful. Hey, John, nice to see you. And so the only risk really with with that is the fact that you're going under anesthesia. And the older you are, the greater the risk of anesthesia. So, once or twice a year, provided you're physically strong, would be reasonable. But we want to make sure we're really understanding the underlying cause of your lesions. So do you have lesions because you have a viral infection? Do you have lesions because you have a prolapse? What was that? Oh. Or do you have lesions because you've got an autoimmune disorder? What we want to try to do is get to the underlying cause of those lesions and try to treat that. Joanne said she can't wait for her flare book. You ordered it a week ago. Should be coming. Yep, it should be coming. Diane, it's the fulguration and laser therapy that is going to be challenging doing it every year over time, because every time you cauterize a lesion, you leave scar tissue, and the more you do it, the more you injure the tissue, which then reduces your bladder capacity because your bladder can't stretch to hold urine. So what happens when you do repeated cauterization is your bladder tends to get a little bit smaller and smaller and smaller and smaller. And it just can't expand because it's got scar tissue. So if I have to choose between the steroid injection and the cauterization, I would definitely be choosing the steroid first. And then, Diane, doing the lactoferrin, not a bad idea. Might be worth a shot. Now Michael here said he did it for 5 months. It didn't help him, but I will tell you, I've got other patients doing it, and it has helped them tremendously. So it's worth a thought. It might be worth doing for a couple of months, 3-4 months, just to see if it might help. Because the IC study that showed that lesions healed is a really good study. And if you go to the front page of the IC network, I have a blog on it with the research. You can look at that study yourself, see what you think. I would be very tempted to try the lactoferrin for a couple of months. Lisa said, I'm not sure if you answered my question. My phone decided to lock up. Is bottled water okay, or is it alkaline or acidic? Well, it depends upon the type of bottled water. Most bottled water companies will have on the label a pH level, and you want to be around pH 7, which is neutral. Spring water is the preferred water for IC patients. It's preferred for anybody with bladder issues. Not purified water, not the other waters. It's just spring water is ideal. And drinking water through a water filter like a Brita filter is not recommended because the Brita filter takes out the pH balancing minerals, so you end up with acid water. So it's better if you've got Hunner's lesions specifically to make sure that or if you've got an irritated bladder in general, go for the spring water. If your tap water is good, use the tap water. Here's something I didn't know because I'm doing this diet guide and I was going through all the probably 100 or 2 articles we have done on diet. I've got a couple articles on water written by other authors, and it turns out that acid water is most prone in the northeast of the United States because of acid rain. That the water out here on the West Coast is not as contaminated because we don't have that heavy industry that they do on the East Coast. So I thought that was very, very interesting. And, with your bottled water, the best bottled water is Evian water, which comes from Europe. We have Arrowhead water. Arrowhead water, which you can get at Costco, at least here on the West Coast, is really good water. But kind of like Dasani water, for example, is made by the Coca-Cola company, and Dasani water is just city water. They've just filtered it, but it's still city water. So when you can, go for spring water instead. John, my friend, how are you doing? How are you doing on this Sunday evening? Hello, Instagram. So this is a support group for men and women who have bladder, prostate, and pelvic pain. And we're streaming on 3 platforms right now. It's just our normal weekly meeting. So we've been going for almost 2 hours now. Lisa said, thank you. I was drinking tap water. I felt so much irritation. So I had a patient this week call me who has eosinophilic cystitis. So eosinophilic cystitis is not interstitial cystitis. It is when the bladder wall gets swarmed with eosinophils. These are white blood cells. And if it the bladder wall becomes extremely inflamed. So for some reason, the human body's immune system is sending and swarming the bladder with massive amounts of our own army, our white blood cells. Eosinophilic system. I've worked with a handful of EC patients over the years. One patient comes directly to mind. It was a young girl who lived on a farm, like in Indiana or Illinois, somewhere in that area. And she had suddenly developed really, really severe bladder symptoms. And when they looked at her bladder and they did her biopsy, it turned out that she had eosinophilic cystitis, and it was horrific. So we were trying to figure out what could it have been, and they found it. That she was drinking, they had well water on their farm, and their well water was contaminated by like a nearby industrial facility. I don't remember exactly what it was, but when they tested the water, they couldn't drink it. It was not drinkable. So she had been drinking a chemically contaminated water that had injured the bladder wall horrifically, causing the eosinophils. And so the reason why I bring this up, Lisa, is that, you know, some tap water is really good and some tap water is really bad. And I would encourage you to, since you say, well, you say here you're drinking tap water and you felt too much irritation, my first step would be, were you drinking too much water and were you just hydrodistending your bladder all day? That's going to create irritation. But it might be interesting to go to your county water agency's website and look at the testing for the water, just out of curiosity, to see if anything's going on with your water quality. And if you're on a well, you can ask them to come out and test your water. Just make sure that something's okay with you, you know, that everything's okay with your water. Diane says, I was tested for Epstein-Barr by my primary care, and that was not easy to get done because no one had heard of the urine test for the virus. The test came back negative. I asked about problems with my uterus being prolapsed, and my urogyn had done a pelvic floor check. Everything was fine. I really don't trust these doctors in my area, the Midwest, really. They don't know much at all. I've had results from my cystoscopy with one doctor saying I don't have lesions, but I had a lot of inflammation while the other said I did have lesions. I've been taking lactoferrin for about 9 months, and it does help because I don't need as much ibuprofen or aspirin every day, but I do need to take a little bit with the PEA for pain relief. Well, Diane, you're making some progress. That's good. I mean, at least we know that some of that inflammation is calming down. So, I mean, I think the question you have to ask yourself is, are you better today than you were a month ago or 6 months ago, or are you worse today? Or is there room for improvement? Is there room for you to get better? If there is, then we want to start looking at other things. I refuse to give up for anybody. We're not giving up for anybody. Man, we just want to look at every single possibility because I would like for you to get some relief. So this is where we start looking beyond the scope of other things. Marlia says, oh my God, Jill, I had no idea about the Brita. You did not know it makes water acidic. You've been using it for 2 years. I must change to Evian ASAP. Thank you, Jill. What would you do without your knowledge? My bladder and belly at the end of the day does burn. It must be the Brita. Who knew? It might be. It would be an interesting thing to change up. You know, that was actually discovered by an IC patient maybe about 10, 12 years ago who, because I talked to her, she called me and told me about it. She just couldn't figure out why she was flaring. And she was having really consistent, persistent flares. And so she thought, what am I doing every day? And it came down to Well, I'm drinking water out of this, so out of a Brita filter. So she got some pH test strips and she tested the water. Her tap water was fine, but when it passed through the Brita filter, it was acidic. And it had become enough acidic that it was irritating her bladder wall. And she said when she stopped that, her flare stopped. Her bladder responded and got better. So is anybody going to do anything for Halloween? I got my house decorated. I've got my purple lights on the house. I got my witches and stuff like that. We probably won't get any trick-or-treaters. I'm sorry to say. I'm gonna go with a friend and go down to the epicenter of Halloween in my town and walk through that earlier in the afternoon. John says, is lactoferrin beneficial for the prostate? I believe that it is. If I remember correctly, I thought I saw a prostate study. Let me look. Let me look, my friend. So I'm going to go to the National Library of Medicine. Now, please know that the National Library of Medicine has been affected by the shutdown. So it's not going to have any new studies. But let's see if there's any old studies. Lactoferrin prostate. Let's see. '87 results. But these are, let me put in lactoferrin prostatitis. And lactoferrin encapsulated dichloroacetophenone nanoparticles enhance drug delivery and anti-tumor efficacy in prostate cancer. Lactoferrin conjugated radical nanoparticles enhance drug delivery and cytotoxicity in prostate cancer cells. So there's a lot of prostate cancer research here. Here we go. Wasn't that interesting? Okay, what is this? Thermosensitive hydrogel with nanoparticles for rectal drug delivery system in the treatment of chronic non-bacterial prostatitis. Done in China. Huh. Okay. That's just lactoferrin receptors, so that's not particularly helpful. The effects of curcumin and lactoferrin inhibits the growth and migration of prostate cancer cells. The synergistic action of lactoferrin in enhancing the safety and effectiveness of treatment against prostate cancer. Bovine lactoferrin induces cell death in human prostate cancer cells. Wow, that's cool. There's a lot of very complex studies here on lactoferrin helping prostate cancer. I mean, legit helping. Absolute quantification of human tear lactoferrin. That's interesting. I would consider it worth a shot because the IC lactoferrin study was just So incredibly effective. Okay, hold on a sec here. Diane says, my problem is my bladder only holds about half a cup before I feel pain and urgency. I'm not sure why, or if there's a physical explanation. I had a low pressure, short duration hydrodistension about 3 years ago, and they were able to fill my bladder to about a cup and a half, but had a lot of bleeding. So yeah, okay. So there's awake bladder capacity and asleep bladder capacity. So when you're asleep, generally that tells you what your real legit bladder capacity is, because you're not awake enough to feel that sensation of urge, so they can just fill it as much as they want. Whereas awake bladder capacity, like done during a urodynamics, that's really a measure of how sensitive your nerves are. So what that tells me, Diane, is that you've got hypersensitive nerves in your bladder wall that are reacting. And now our job is to figure out why those nerves are so vulnerable. They could be vulnerable from estrogen atrophy. They can be vulnerable from infection. They can be vulnerable from long-term pelvic floor dysfunction. They can be vulnerable because you have Hunner's lesion. Therapeutically, our goal is to calm all these nerves down and to protect the nerves. So like Bladder Builder, I think would be a really nice choice, because the chondroitin acts to protect the bladder and the PEA in it acts to calm nerves down. And so that's a lovely combination, which is why Bladder Builder is by far the best-selling over-the-counter supplement in the IC world, at least in our office. And it's got great reviews on Amazon too. Cheryl says, in 2017, I had a UTI that would not go away. I had multiple antibiotics, went to a urologist, had a procedure where they filled my bladder with water and took biopsies. My post-procedure appointment, he handed me a list of foods that may irritate my bladder. So I was never phenotyped. I'm taking amitriptyline, but lately I have a lot more pain than usual. Would Bladder Builder be an option for me? So Cheryl, it could be, but we're flying blind here. And the best way to make a decision about a treatment is based upon your anatomy. We call it phenotyping. We have to really try to understand what your IC phenotype is first, because not every IC patient is the same. Again, for some people, it begins in childhood. For others, it begins after menopause. For some people, it begins after going through chemotherapy, because the chemicals of the chemo damage their bladder, while for others, IC begins when they fall and break their tailbone. So we all have the same diagnosis, interstitial cystitis, but are we all the same? Absolutely not. We're not all the same. And here's what we've learned over the years is bladder treatments don't work for the great majority of patients. They don't. We've had patients who have been on bladder treatments for decades and they're not better. They're still flaring. Why? Well, about 7 years ago, 8 years ago, the powers that be, the IC researchers, the clinicians they all understood that there were a lot of different types of patients. They started trying to understand the groups or the phenotypes. And today now we have widespread acceptance, including in our national guidelines from the American Urology Association, that there are different patient groups, each with their own treatment priorities. So we need to figure out what your group is. So group number 1 is Hunner's lesions. If you had a visible wound on your bladder that they saw when they did your hydrodistension, but if you, so if they did and they told you you have Hunner's lesions, you're in that group, but you probably aren't, because you haven't mentioned that they treated you. Okay. Group number 2 is bladder wall driven. And in this group, we're going to look for a couple of different things. The first thing we're going to look for is a chemical injury to your bladder. because the bladder, like any other part of the body, can be injured. And generally, it's injured through a chemical exposure. And so these are the patients whose symptoms begin while they're going through chemotherapy, or their symptoms begin because they're drinking Diet Coke or Mountain Dew every day. You know, the bladder, like any other part of the body, is going to be injured, and it's injured through chemical exposures. The bladder was not designed for strong acids every day, and it will eventually break that tissue down. If you're drinking a lot of green tea, if you're drinking a lot of, of harsh sodas, that's a problem. So if there's a chemical injury, we have to eliminate the chemical to help the bladder heal. The second thing we're going to look for is the quality and health of your skin. Are you of an age where we are now seeing estrogen atrophy? Aging affects the bladder. Having a hysterectomy affects the bladder. Being on estrogen suppression medications affect the bladder. As estrogen levels drop, the bladder's thick coating thins, and the bladder cannot defend itself anymore. So if you are in estrogen atrophy, our therapeutic priority is to help your skin make more mucus. And the way we do that is with estrogen and or with a treatment that might coat the bladder, which is going to be like bladder builder. Okay. Our next big phenotype is pelvic floor driven. So these are the patients who have symptoms that are being driven not by their bladder, but by something outside of the bladder, usually an injured muscle or usually an injured muscle. So if your symptoms began after falling on your tailbone, if your symptoms began after an accident or having a baby. Now, the problem here is that you have all the symptoms that you would associate with a bladder infection: frequency, urgency, pressure, pain. And you're calling the doctor going, hey, man, I got a bladder infection, and they give you antibiotics and they don't work. And you call the doctor back and say, it didn't work. I want more antibiotics. And before you know it, you're on long-term antibiotics, but they don't work. And you're very, very confused. Surely I have an infection. I'm up all night. I'm peeing all the time. Then you go back to the doctor and the doctor goes, maybe you've got overactive bladder, and they give you overactive bladder meds. They don't work. You go back to the doctor 6 months later, a year later, and the doctor goes, God, I hate to break it to you. I think you got interstitial cystitis. It's incurable bladder disease. And guys, just know that that's not true anymore. Okay. But you're so happy to have a diagnosis. It's like, finally, somebody's telling me what this is. The doctor hands you the diet. The doctor gives you some meds. You go home and you do it. You follow the diet. You take the meds for 6 months, a year, 2 years, 5 years, 10 years. But you still flare. You're still having symptoms. Why? Surely if this is a bladder disease, bladder therapies would work, right? Well, guess what? Bladder therapies don't fix tight muscles. This was me. I did bladder therapies for years, never got better. Didn't know anything about the muscle. Then the research came out. I went and got my muscles checked. My God, my muscles were like concrete. They were so hard. No wonder sex was painful. Physical therapy fixed that, which is why I'm healed. We now recognize that 85% of IC patients have tight pelvic floor muscles. Not 85% of IC patients, the vast majority of IC patients, have tight muscles. We also know in federally funded IC research studies that pelvic floor physical therapy outperforms virtually every bladder therapy. And when that study came out in 2008, everybody went, uh-oh, wait. Well, IC is an incurable bladder disease. Why the hell would physical therapy help? Oh, maybe it's not an incurable bladder disease in some patients. Maybe it's an injury instead. And now we know that that's true. So we want to know if you've got tight pelvic floor muscles. Our fourth phenotype is pain when you sit down that gets better when you stand up. That is a neuralgia. if you have a history of sciatica, if you have pins and needles, areas of numbness, do your feet go numb when you flare? You have a vibration when you sit down. Those are tight muscles squeezing nerves. That's pudendal neuralgia. So our therapeutic priority is to relax the muscles and calm the nerves down. And then last but not least, our last phenotype, which is our second biggest group, is the widespread pain group. These are patients who have IC, IBS, vulvodynia, TMJ, migraines, fibromyalgia, characterized by very sensitive skin, wicked sense of smell. We can smell things that other people can't smell, and smells drive us crazy. If you're in this group, this is about your central nervous system. So our therapeutic priority is going to be to calm that central nervous system and try to get that nervous system out of fight or flight, because the odds are you've got an anxiety disorder. This is all driven by a really significant trauma, an injury, physical injury, or abuse. So my phenotypes are pelvic floor widespread pain. So what I do is I would work very hard to get my muscles as healthy as I can. And I'm always working on trying to keep my nervous system as calm as I can, because my nerves are on a hair trigger. Redhead, but I'm also a trauma patient. I was attacked when I was very young by a young man who later became a rapist and murderer. So I dealt with some really significant life stress when I was younger. So we need to know what your phenotype is. On the IC Network website, icnetwork.org, if you go to the top, there is a masterclass, the IC 101 masterclass. It's a free video series. You don't have to pay anybody to learn about IC. Literally, there's a free video series right there along with our website. And our website has been rated the best IC website in 2 peer-reviewed medical studies, including Harvard and the University of London. So you can come to the IC Network. You can rely on the information from the IC Network. But I think that video series, especially episode 4, will help you understand a little bit more about these groups. So, you know, if you are in the estrogen atrophy group, then doing something like bladder builder would be reasonable. If you're in the chronic UTI group or the Hunner's lesion group, then the lactoferrin would be reasonable. If you're in the widespread pain group, then the Peora, which is what I take, PEA, the PEA 500, then this is probably what you could try for a couple of months and see if that helps. It helps me tremendously. Marlia says, I will discontinue the Brita, start the Evian, and keep a diary and report back. Yes, well done. Rebecca said, I have a high eosinophil count, white blood cells also. What else can that come from besides water? You have Hunner's lesions. Well, I think it could come from chronic infection. I think it could come from chronic viral infection. Again, when they biopsy lesions, there is literally a biological war happening in the center of that lesion. And if that lesion is being driven by viral infections, that would explain that. And I just think chronic inflammation, irritation, exposure to chemicals could do it too. There's just eosinophilic cystitis is a rare disease. And honestly, I studied it extensively maybe 15 years ago. Let me just see what the new stuff says here. June 2025. October 2025, mepolizumab in the treatment of eosinophilic cystitis. And here's another one, a rare presentation of recurrent EC in a child. just want an infant? Oh, there's just a lot of new research with this. I'll have to go through it. They have an eosinophilic mimicking bladder tumor, but it's not a tumor. Eosinophilic cystitis can cause growths. It's kind of like fluid-filled sacs that can look like a tumor, but are not tumors. They're benign. Diane said, I wasn't able to take Bladder Builder because something bothered my digestive system. I've been able to take Cystomen for over a year, and I think it helps. I take one pill in the morning, one pill in the evening. Should I take more? It has some chondroitin and PEA. Well, you could go up to the manufacturer's dose. I mean, if there's room for improvement, you're tolerating it well, you know, so you could potentially go up another pill. You do one in the morning, two in the evening, and for a couple of days and see if that makes a difference. I mean, you seem to be tolerating it well. But that's your decision. I mean, I can't give you medical advice. It's never my place to give you medical advice, ever. My goal here is to give you options. Let's see. What is the manufactured recommended dose? So this is Cystomen, made by the same company that makes Bladder Builder. And it's kind of what I call the kitchen sink approach to it. It's got a lot of different things in it that do different things, like D-mannose. It's got PEA in it to calm nerves down. It's got quercetin in it and chondroitin in it, along with like pumpkin seed extract and things like that. So what is their dosing? They say 3 capsules in the morning and 3 capsules in the evening. So you're definitely well below their recommended dosing. So you could try 2 in the morning, 2 in the evening. I would just increase gradually. I'm not a more is more kind of person. I'm kind of a less is more kind of person. And so I don't look for the highest effective dose. I look for the lowest effective dose because I tend to be very prone to side effects. So I would approach that very slowly. Deborah said, do you need a doctor's order to see a physical therapist? The answer is it depends upon your state. In some states, you can self-refer. Like California, you can self-refer up to 10 visits. In other states, you have to have a doctor's referral. If you go to pelvicrehab.com, pelvicrehab.com, you can search by zip code for physical therapists trained in pelvic floor work. Just call their office and ask them. They'll tell you what you need. I don't know a doctor who would say no to it. You know, I mean, it's just standard of care now. I mean, having a proper pelvic floor assessment at least once is just standard of care. Hello, Happy Pelvis. We are doing a live support group meeting on YouTube and Facebook also, which is why I'm looking that direction. Nice to see you. Hello, Carrie. So we've been going now for about 2 hours and 15 minutes. This is our normal weekly live support group meeting. All right. Lisa says, I was only drinking tap water at home after work, then went to bottled water. Now that you talk about acidity in bottled water, I will be checking the pH in the water, in the bottled water, and you will be getting spring water. What do I ask the water county concerning the water? I think you just want the basic safety testing. That's all. I mean, the contaminants. I mean, how do I say this without being incredibly cynical here? I have 2 degrees in chemistry. I wouldn't touch a chemical company. I wouldn't trust a chemical company at all at this point in time. I think we have a lot of toxins in our environment. I think we have a lot of companies that are releasing a lot of toxins into our water and into the environment. And and then you have to throw in forever chemicals, which they're finding everywhere, even in the Arctic. Forever chemicals like that come from Teflon pans and things like that. And so every water company has to, serving a large population, they're dancing a delicate dance. They want to make sure the water is safe, but they know that there are always exceptions. There might be a little bit more of this and a little bit more of that, and they don't want to alarm the public, so they don't talk about it. And I think you really see it in beaches now, like here in California, and especially in Hawaii. They are now finding so many bad things in ocean water. I mean, especially by big cities. So you always, always, always want to pay very, very close attention to the small little warning signs when you walk into a beach area. Again, like on Waikiki or Hanauma Bay in Hawaii, if you go to Hawaii, or Malibu Beach. I mean, they're closed frequently because of high levels of E. coli and coliforms. Because what happens is they pipe all the sewage, at least off of Waikiki, because I've got family there, and this actually happened to me. They treat the sewage, and then they've got a pipe that goes out 5 miles, and they dump the treated sewage in the ocean water, where the tide brings it right back into the beach, and you're swimming in it. And one of the last times I was in Hawaii, I had a flare on the plane, and I thought I had a UTI, so I went to Kaiser the next day because I was in a lot of bladder pain after the plane flight. And I had this little, almost elderly Japanese female doctor who saw me, and she could barely speak English. I mean, it was really interesting. And she said to me, she said, "You no go water, no go beach, no go water." And I'm like, huh? And she said, "No go water. If you're going to go, up to your knees. Don't go any farther in the water." And she didn't explain it, but she was very, very, very firm. My mom was with me, and she just said, "Water problems, don't go in water." So we were there for 2 weeks visiting family. So I didn't go in the water until the very last night. And I wanted to go snorkeling. So I went snorkeling in Hanauma Bay the night before we were supposed to fly home. And had a great time. And that night, I woke up with the room spinning. Like I would try to focus on the clock on the wall, and my eyes did this. I couldn't focus. I was just in the spin. And I crawled on my hands and knees down 2 flights of stairs to the basement where my parents were. I was on the 2nd floor. They were in the basement. And we called the hospital because I couldn't stand. I couldn't walk. And so we called the emergency room and described it. And they go, "Oh, yeah, you got the sewage virus in your ears." We're like, "What?" He goes, "Yeah, we see at least 20 of you a day." And it's like, "Didn't you see the warning signs by the beach?" And we're like, "No." So I had a sewage virus in my ears. And I couldn't fly home for another week, and I almost got fired because my boss didn't believe me. But here's the funny thing. So I was just outraged. I mean, because for about 5 years, I couldn't go in an escalator or an elevator without my head spinning, because I had this virus inside my ears. And a couple months later, our local TV, a TV station, the consumer guy, did a whole expose on this. And it turns out that lots of people go to Hawaii and they get sick with these sewage things. And so they like flew to Hawaii and interviewed the health people. And the health people said, well, they said, why are you telling the honeymooners that are coming who are swimming, why aren't you telling them that this water is dangerous? And they just kind of said, because we live on tourism. And then it's like, well, then how do you inform people? They go signs. So they went and looked for the signs. The signs were tiny, saying that there were problems. I mean, it was this huge, huge problem. And it's still a massive problem. And if you were to come to California, you just got to know that those beaches in Southern California are closed frequently because the water quality tests are bad. So just fair warning. We have issues with water. And yet our water is way better. Imagine living in India, where water quality is much, much more challenging, or in China, where literally some of the rivers are dead. There's nothing living in them because there's so much toxic waste put into the water. Here, hold on. Lori says, what about the plastics they're saying now found in bottled water? That's real. So if that's the case, then I mean, we're at a very, very difficult place because Lori, you raised a critical point here, and that every bottled water has microplastics. We are ingesting lots of microplastics that's getting into our body, that's getting into our kidneys, it's getting everywhere in our human body, and it's causing damage. Back before we had bottled water, because I remember that because I'm that old, what we had were big 5-gallon glass bottles of water that we would bring into our home. And that's what we used to do. And you can still do that. If you live in an area where your water quality is very bad, you can either pay thousands of dollars for a good water filtering system, or you might be able to find a water company that will deliver water in glass bottles. But I mean, yet again, another way that we're damaged by companies making a profit because they don't freaking care if they hurt us or not. And plastics are rough. John says, how do we effectively advocate for ourselves when the medical system is so complicated and getting worse? It seems that doctors would rather pass patients off to specialists, further fragmenting care. I think, John, it's with our knowledge. The more we learn, the more we can take control out of those doctors, our appointments with doctors. I always say, do not walk into a doctor's office and say you have IC. That's a horrific mistake. You have to walk into the doctor's office having read everything you can read, especially our book, IC 101, and our book, and Dr. Weiss's book, Breaking Through Chronic Pelvic Pain. You walk in there knowing more than they do so that you can ask exactly the right questions and use that appointment to your advantage. So it's like, okay, doc, here's the issue. I have pain when I sit down that gets better when I stand up. I believe that this is a pudendal neuralgia. I've done my reading. I would like for you to check my muscles. Hey, doc, I'm not responding to bladder therapies. Every bladder treatment you've done is not working, but you've never checked my muscles. I would like for you to check my muscles. Hey, doc, I've been on Elmeron for 10 years now. I'm still flaring. I don't know if it's really working for me. What are my other options? And hopefully you already know what those options are so that you can ask questions. I mean, you just got to walk in powerful, empowered with knowledge. The worst thing you could do is walk into a doctor's office and just say, I don't know what's wrong with me. Just do anything. Give me anything. I'll take anything. That's just not going to get you where you need to go, because you have to understand what's driving these symptoms in the first place. This is all about underlying causation, cause versus effect. We also don't just want to chase the symptoms. We want to find the underlying problem and fix the underlying problem. And so when patients call me, like I was doing a coaching on Friday, and she kept saying what all the treatments she's done. And I kept saying, no, don't tell me that. I don't want to know that right now. I'm just trying to understand your body a little bit more. So let me just ask you questions about your body for a moment. and your symptoms for a moment. And she kept going, but I did this and this. And I'm like, I know, but it's not working. So just stop it. I don't want to hear about that right now. Tell me about your body. And then, so it's like, where is your pain? Is it inside of your body? Is it on the outside of your body? Is it to the left, to the right? When is your pain the worst? You know, and just really getting into kind of symptoms and anatomy. And then I asked very, very detailed questions like, do your feet go numb? Do you have tingling in your feet when you flare? And that these kind of nuanced questions really help me help patients phenotype. Peggy says, zero water filter. I've used zero water filter for years. It takes everything out. Never had any problems with it. Good. Okay, that's a good recommendation. Judith says, I posted a question about cauda equina crowding. What I'm experiencing was more like pelvic restlessness, not pain. Feels like nerve hyperactivity. Do you have and you're scheduled for an SI injection? Well, my friend, from one SI patient to another, I've had 3 SI injections on my left side. And right now, as I sit here, I have a vibration in my left butt cheek. It doesn't hurt, it vibrates. I've had it for 20 years. The more I sit, the worse it gets. So, pelvic restlessness, like nerve hyperactivity, I have that. And I feel a fluttering or a vibration. So do you feel anything like that? Hi, Maeve. You know what? I'm gonna turn off the Instagram. Bye, Instagram, because I think we're done there. All right, Instagram is done. You do? Well, welcome to the club, my friend. You know who had a really good explanation for this was Robert Eckenberg, Dr. Robert Eckenberg, who was our top pelvic pain doctor before he retired last year. And he's still seeing patients, by the way. I mean, he will work with patients over the phone and Zoom. For anybody struggling with intensive pelvic pain, Robert Eckenberg is available for consultation, and he is brilliant. And I was talking to him about this constant fluttering that I feel in my left butt cheek. And it's always around my sit bone. Like right now, it's on the outside of my sit bone, but it's right by the sit bone. Sometimes it's on the inside of the sit bone. And that is, how did he describe that? It's like a profoundly injured muscle that is quivering, or a very weakened muscle or muscle nerve that is quivering. So, Judith, have you ever tried an SI belt? Oh, see, like it just got bigger because I tilted to one side. And again, thankfully, it doesn't hurt, but it's annoying as hell. Have you ever tried an SI belt? Let me go get my SI belt. Hold on a sec. I've got 3 of them. Okay. Let me take this off for a second. Okay, so hello. So hips right here. And yes, I do have a little tummy. It is there. Hello, menopause. So the purpose of an SI belt is to stabilize the joint. And so here, hold on a sec. So this is my favorite one. And you basically put it over the hips because your SI is like right there. And you would wear it like this. And so what it does is it stabilizes the joint. So if my SI is getting real funky, I will put that on. This is the first one I got. That got both of these on Amazon. Oh, no, I didn't. I got this at a local surgical supply. This one's a little bit bigger. You can see, so it has kind of more space there. So Judith, you should get one. I mean, they're like $25. Oops, hold on. Okay. Oh, Peggy said SI belts are the best for pain in your lower back and your SI joint. You told me to get one last year and I won't go without it. It's a godsend. Yes. That's what we like to hear. There goes my tonsil. That's my body's way of saying you're about done talking for the day. You're welcome, Judith. I can give you a link if you want. Here, hold on a sec. Let me go to Amazon. I'll give you a link to the one I got. Hold on. I can go right to my orders and find it for you. You know, what was funny is my dad used my white one. Okay. No, hold on. SI. Sacroiliac. Ah, here it is. Found it. Yeah, that blue one I bought 8 years ago, and it's still good. Okay. There you go. The Sorolla sacroiliac belt. Man, it just got cold. Have you guys, let me just ask you this. Like, we have had the coldest summer ever, and we're having the coldest fall. Our weather right now is weather you would expect to see in like December. And I am cold all the time. But I mean, like legit, everybody's saying we've been robbed of summer because we just didn't have warm weather this year for California. It's crazy. It's just been the weirdest, coldest year ever. Anybody else feel like you're already in December or January with your weather? Oh, I can take these off. Yes. Oh, my ears are clean now. Oh. Peggy says, yes, I know. It's weird. It's weird. Let me show you. These are. I'll show you while we're waiting. Obviously, we're near the end of the meeting. So, and I'm happy to go into Zoom if anybody wants to go into Zoom. I'll show you some of my favorite Halloween decorations. I love this series. So she's a little angel. I'm a little witch. A little Frankenstein. A little mummy. A little Superman. And there's more. There's more on the window. I've got little butterflies and little dinosaurs. I've come to now that, you know, I'm realized that I was so involved with elder care for so long that I almost like don't know what to do with myself in a way. I mean, I do, but I've never been able to play. I mean, I just literally in the last 25 years was just heavily involved with caring for people who were ill, and I still care for people who were ill through the IC network. But now that my day is not consumed with elder care, I find myself trying to figure out what my life is supposed to be like, you know? Like, what am I supposed to, it's not what am I supposed to do, it's how do I want to live? How do I want to live? It's so foreign to me to think about what I want to do. It's just it's very hard for me to describe, but it's like I'm on this discovery of who is Jill Osborne now that she's no longer giving everything she had to other people. Now I can do things for me, and it's surreal to be in this place. And so what I find that I am in cave woman mode. I am still reeling. And so the way I envision myself is that I'm like a wounded bear in a cave, but I'm healed. I've healed, but now I'm just so traumatized by what I went through that I'm still kind of in my cave a little bit. And I have a lot of moments when I just like, I just like put out the warning, just leave me alone. I just need to recover my heart and soul. And I'm making progress, but I'm still a bear in a cave. You know, I'm definitely still there. And now I have to decide what I want my cave to be. And it's hard. I'm not explaining it well. And how I want to spend my off time. I haven't had choices in so long that now that I have choices, I'm just trying to find that peace again. So I get peace decorating and I just move stuff around constantly in my house. That's all. I love doing it. I love doing it. It makes me happy. So just finding things that promote happiness is important. Judith says, I understand. I took care of my mom for 7 years. Yeah. You know, and just trying not to get lost in you know, coulda, shoulda, wouldas. It's hard not having children. It's very hard not having grandchildren. It's very, very hard. And I always had hope, always. And it didn't happen. And you know, so I watch other family members with their extended family, and it's just me alone going, oh, okay, what am I supposed to do now? You know, it's at a really weird point of life to be at. So, and I've started seeing somebody potentially, but he has stage 4 cancer. And, it would be, he makes me laugh so much and I like him, but he's got cancer. And I just cared for 2 people who were dying. And so I'm just trying to I'm not jumping all in, I'm just like, I'm in the friend zone right now. My answer is I just want to play games. I want to go sit on a beach for a year. I just, my brain can't go there right now. It just can't. I'm just too fragile. But I'm not fragile. I'm strong, but I'm just not capable of doing more right now. I am a wounded bear in a cave. That's the only way I can describe my state of mind right now. Bonnie says, we loved you, Jill. You're such a thank you, honey. I'm trying real hard, but girl, I've got like 6 hours a day in me where I'm really good. And then I just have to rest. Peggy says, I know how you feel. I just started driving again and I feel free. I used to love going to the mall and making small talk while sitting. I love people watching. I'm so sorry to hear that about your friend. Yeah. But do people go to malls now? I haven't walked through a mall since COVID. The only mall I go, maybe once every 2 years, I go to the Apple store. We used to love going with friends, going to the mall, going to Macy's, walking through, and then going and getting lunch somewhere or getting a hot cookie or something like that. That's part of the problem here. At least to me, that's part of the problem because I keep going, what did we do 20 years ago before the internet? Like, how did we fill our day? And I know that we went to the movies, our friends got together, we went shopping, we would go out to eat. We would go on hikes, we could go on walks. And now everybody's tied to their damn phone. And then when COVID happened, the socializing that we used to do just stopped, and restarting them. It's like we've all been trained into living electronically. It's like we've forgotten how to live the way we used to live. And so I'm getting really territorial now about what's coming into my brain here. Like, because I'm not interested in looking at blood and guts. I'm not interested in watching people dancing. The internet drives me bonky right now. So aside from doing these meetings, I am not on the internet. I go to YouTube and I go to Netflix, and every now and then I look at Twitter. Because my soul needs comforting right now. I just need comfort. And so I have been watching old shows. I have been listening to older music. It's like I'm craving the things that we did when we were younger that made us feel good, that we just don't have so much anymore. So like some of those old TV shows I constantly turn on some of the old British shows, like Are You Being Served and Keeping Up Appearances and Poirot and Miss Marple. I grew up on those. I love those. I've got great family memories of those. But I also turn on K-pop Demon Hunter all the time. I love that. I love K-pop Demon Hunter. I love the lyrics in it. I love, we broke into a million pieces and can't go back. I've found the beauty in the broken glass. My God, the lyrics in K-pop Demon Hunter just speak to anybody who is struggling with illness and or injury and or sadness. It's about picking yourself up again despite your differences. You can look different, and you might be criticized for looking different, and you might fear how you're being judged because you look different. And this movie just reminds every child watching it and every adult watching it that none of us are perfect, and we all have to learn how to pick up those pieces and put them back together. There's beauty in the broken glass and in the broken pieces. Oh my God, that resonates so strong in my soul right now. Judith says you have to protect yourself. Yeah, man, I just feel. I got a book by one of my favorite authors, J.A. Jance, and it was about a mass murder. I got a chapter in, I put it down. It's like, I do not want to read about that stuff. Give me something happy. I just want to be happy. I want to feel comfort. I want a cozy home. Merlia, girl, we're in this. I mean, so Merlia says kind of the same thing. And Donna, I will get to your question. Give me a sec. So Merlia says here, I totally get it. I cared for my partner and he passed from cancer. A few years ago, I began a new relationship with a great guy, but I just couldn't anymore due to IC and atrophy. So I ended it. So I'm struggling and reeling in sadness, just a cocoon in my cave safe place. I was an artist and painted a lot, and I haven't touched a paintbrush in a year. Marlia, girl, you go get that paintbrush because you have a story to share now. Every day is a new day for us. We're not the same person that we were 5 years ago. Every day we're a new person, and we get to rediscover who we are on any given day. And your art and my art is critical to ourself, to our ability to express how we're feeling. I don't know. Do I feel sad? I do not feel depressed. I really don't. I have moments when I'm sad, but it's not all the time at all. It's just it's kind of like you're reeling with changes. Like there have been so many changes that you just kind of want to turn around and just do this and say, world, go by, just leave me alone. I just need to be. The changes are hard. Peggy says, I wish we lived closer. I think we'd have a blast getting to it. Girl, you know we would. You know we would. I wish that I wish we were so much closer. I think we'd have a blast hanging out. You know, I just really think we would, because we can say what we need to say, but also we can bring the humor in it. You know what? I'll tell you, like, I like shirts with slogans. I have quite a few, although I don't wear them in meetings very often. So I like to try to find the humor in IC and just the humor in life in general. The Signals catalog is really good for humorous things like that. Anyway, a shirt that I made several years ago for IC Awareness Month, and this was probably 15, 20 years ago, was ICers do it frequently and urgently. I still think it's perfect. I imagine walking down a beach with a shirt that says, ICers do it frequently and urgently. And they're like, sex? Really? Frequently and urgently? It's like, no, because they don't know what IC is. I think that is the most hysterical IC shirt ever. I should make it again. I mean, it's funny. You have to admit, it's really, really funny. Diane says, Thank you for all your help. I know what you mean. I have such a hard time getting out socially unless it's a family event. I need to push myself to join an in-person exercise class or book club, or just join a gym. Like I've joined a gym. And when I'm feeling good, I'll go 3 or 4 or 5 times a week. If I'm not feeling good, I back off a little bit. So I was in the ER last Monday with my heart. So I'm going a little slow this week. It's just a thing I inherited that is not going to kill me, but when it happens, it scares the living daylights out of me. I get really severe arrhythmias and PVCs. It's been going on since my 20s. And my dad had it too. It's sunken chest syndrome. So I don't know if you can see this. Let me see. So you guys, there's no breasts. I'm not going to flash anything because I don't have boobs anymore. So there will be no nipples work at all, right? So here are my incisions. And you can see that I'm kind of concave here. Isn't that weird? That's sunken chest syndrome. So my dad had it. And so what that means is that my chest cavity is shallower than normal. So there's not enough room, as much room in my chest for my heart and my stomach like there is in your room, in your chest. And so what happens then is if my stomach gets really, really upset and gassy, it pushes up into the base of my heart and it makes my heart gets, it's like it tickles my heart. So then my heart rate gets all funky. And so that's what happened on Monday. I just ate too much and I was very busy. I was on the phone for 7 hours that day with patients. And then I hadn't eaten. So I ate a really big dinner and that was stupid. And I really upset my stomach. And so I really upset my heart. So 8 hours at the ER. No heart attack. All my tests are fine. Everything's fine. I'm good. I just have this tickly heart. Very annoying. So I have to go back to the gym next week. Peggy likes that shirt idea. All right. So hold on a sec. We had a question about East Gym. Donna said, what do I think about East Gym for pelvic floor muscles? I used it twice last week, and my muscles have been worse. Well, how are they doing it, hun? Is it a vibrating stimulator? I mean, how are they doing it? A vibrating wand? Or is it a machine? Or is it pads that are delivering electronic impulse? Or is it that, who's doing it is Ken Peters is getting really good results with a variation of East Gym that's relaxing pelvic floor muscles. So I'm not sure the technique or the method that you're using. Pads with the electronic impulse. Well, is it hurting where the pads were, or is it hurting somewhere else? Because with the pads, there's an electric current going in the skin where the pads are, and that could inflame the nerves in the skin. They're used on your lower back. Donna, I don't know. You're going to have to ask them. I have no clue why that would be happening for you. I'm sorry that's how, I mean, it's really good that they're trying a lot of new things, and we're seeing some very interesting success with relaxing muscles this way. Let me pull up my email from Dr. Peters. Because I can read that to you. So hold on a sec. Because I specifically asked him about it. soft pulse. It's called soft wave. And so he says, soft wave has been a great addition to our pelvic pain treatment in women and men. We presented data at the American Urology Association conference and another conference. Are currently writing up more and getting ready to start a research study. They treat the perineum to pick up the pelvic floor muscles and pudendal nerve, and often the hips, which are pain generators. Additionally, specific areas can be treated, such as the penis for penile pain, the clitoris for clitoral pain, and the suprapubic, groin, and low back. Wherever there are pain generators, almost everyone feels better after treatment, and the pelvic floor is much relaxed. But since this likely works by activating genes that improve blood flow, nerve function, and attract stem cells, the long-term responders to continue to improve 16 weeks and beyond after finishing 6 weekly treatments. So the soft wave, you lay on a pad that's generating these waves, and then there's a little pad that you put over your pelvis. So you got waves coming from underneath you and on top of you. So that's kind of the future for that. That looks very, very compelling. Hey, Sue, how you doing, girl? How are you? You gonna share what happened to you? I'm so proud of you. Here, hold on, I'm cold. Up. I love these long, long shirts. Oh, okay. So I go long up here, but then I can use the zipper down here and free my legs up. All right. So we've been going for about 3 hours now. So let's do this. I mean, we're very close to the end here. Let me do a last call for questions. Last call for questions. Otherwise, I hope that you have a really fun Halloween week. Enjoy those kids. Oh, let me show you. I'll show you my costume. Hold on. Hold on. So last year, a year ago, last year, again, I was recovering from surgery and, was just trying to get through the day because I was in so much pain. So I decided to make a costume. And so this is a kind of a medieval witch's costume. So like that's the arm. And then on the back, it's got that. And then it has, I almost wore it today for the meeting, but, and then it has a cowl so that, you've got kind of a cowl. Well, it's like a medieval thing anyway. And this great sparkly fabric. It's just a little tight in the armpit. So I've got to adjust it a little bit. Sue says, nope, I need to move forward dealing with long COVID. Pelvic issues, trying to find a doctor that can help me and not just tell me, yeah, girl, just keep on fighting, my girl. Just You are a strong woman. Always, always remember your strength. Everything that you've gone through, like, holy hell, you are like Wonder Woman. Be proud of everything that you've done. All right, guys. I think we're done. I think I'm done. If anybody has any questions, you can call me all week. I'm here. I'm here at the IT Network. Please think about becoming a member because that's what helps keeps us doing these meetings. And I'm working right now on the IC Diet Guide, and the Flare Guide is already done. You can already buy that. The Diet Guide's looking awesome. Really happy with it. And so that's what I'm going to be doing until the end of the year, is working on all these new books. So, and doing these meetings. All right, guys. I'll see you later. Goodbye, YouTube.